From awkward patient interviews to those fieldwork moments you wish you could redo, this is a video I wish somebody had made when I was starting out. Hi, I'm Dr. Brandy Archie, occupational therapist and founder at AskSAMIE, a knowledge base of OT goodness for clients and OTPs alike. But today, we're diving deep into something that matters to every OT, whether you're brand new or 20 years in, and that is how to improve your practice in a way that supports both your patients and your professional growth. So let's get into it. Now, we've all been there, working with a client with cognitive or communication challenges and realizing, whoa, this isn't working. Or maybe having a client who somehow has no goals or connection to regaining their independence. Reddit, OT Facebook groups, and fieldwork forums, they're just full of stories like this. These aren't isolated experiences. They're signals that we as a field are still figuring out how to ensure that the general public understands what we do and how we can help. Building an occupational profile, and there are a lot of example assessments, is one of the most powerful tools we have. There are hardly any other health professionals that are digging this deep in people's everyday life. But here's a problem. The language that we're given in school is often written for therapists, not for people we serve. I struggled with this in my first job in a skilled nursing facility because speaking in someone else's vernacular is a skill that we build up over time as we practice. So maybe instead of what are your meaningful occupations, try what's something you look forward to doing each day? Or tell me about a typical morning at home. What's easy? What's frustrating? My favorite on eval is, if you got discharged right now, what would be the hardest for you to do at home? This grounds your questions in context that's relatable, especially for clients with cognitive impairments, aphasia, or limited health literacy. Here's strategy number 2. Consider using visuals or prompts. Maybe bring a sample deck of cards with photos of walking a dog or cooking or gardening. Ask them to put these in piles. Which of these do you still do? Which of these would you like to get back to? Not only is it an engaging conversation, but you can work on fine motor skills and standing activity tolerance if you want to get fancy. Strategy 3 is to break it up. While you do have to get that eval in that first visit, you don't need to feel like you have to have a full occupational profile outlined in one sitting. Use it as a rolling conversation, and you'll often get better knowledge as time goes on, especially if you work in a setting where you get to work with them for a while. So let's talk to the fieldwork students for a minute, or honestly any of us who still remember that first awkward client interaction. Fieldwork is where theory meets reality, and sometimes that reality looks like a patient refusing therapy, a caregiver correcting everything you say, or you blanking out mid-session because your plan isn't landing. Here's what helps. Number 1 is practice saying hard things. You know, it's okay to say, sounds like today isn't a good day. What would feel most helpful to you right now? I want to make sure we're working on what matters to you. Can I share an idea and get your thoughts? Tip number 2 is make reflective practice a habit. After a tough session, take 5 minutes to journal. What did I notice? What worked? What could I try differently next time? Over time, you'll build clinical reasoning that's less about memorizing and more about adapting. And there's tons of ways to journal. You can even use your voice memo. Tip number 3 is you should know that this is normal. Even seasoned OTs still walk out of sessions thinking, yikes. That's just part of practicing. Give yourself the grace to learn. Okay, so a lot of threads on Reddit mention frustration, not really with the patients, but with family members or caregivers. This is actually why I'm not a peds. Working with parents can be really challenging. So big ups to all the peds therapists because y'all are amazing. Okay, side note, sorry. Whether it's a caregiver who answers every question for the patient or someone who's skeptical of therapy altogether, here are a few strategies. 1, acknowledge their role early. Say something like, you're such an important part of this care team. What questions or concerns do you have today? You can also set expectations up front. Maybe say, my goal is to help your wife become more independent. So I might ask questions directly to her and have them try some things on her own first. Use education and not explanation. Caregivers really don't need the full OT framework. They need to know how it will help their person. So consider using function-based outcomes like, We're doing this now, so it should be able to safely get out of the tub without assistance later. OT is a practice. It's not a perfect. If you take nothing else from this video, take this. Being a better OT isn't about having all the answers. It's about being curious, adaptable, and client-centered every single day. Whether you're reworking your occupational profile questions, prepping for fieldwork, or navigating caregiver dynamics, it all counts. And you don't have to figure it out alone. So check out OT Connected. It's a place built just for OTPs to share resources, insights, and get connections to people and clients who need you. This community is full of people asking the same questions and learning together. So join us. Use the link in the description, and if this video helped you feel more confident in your practice or even just validated a frustrating experience as an OTP, give it a thumbs up, subscribe, and share with another OT. See you in the next one.